Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video we're going to be talking about breech presentation and what does that mean if the baby is breech. So let's get into it. So breech describes when the buttocks of the baby is in maternal pelvis instead of the head. Alright, so the majority of babies are head down. A breech baby is upside down, so their bottom comes first. This approximately happens about 3% of all births. So not common, but it's actually the most common male presentation. The third, which would be shoulder, which happens even less than this. So how do we know? How would we know if the baby is breech? A couple of things can tell us this. So we can figure it out when we do Leopold's maneuvers. So that's that series of hand motions we do on mom's stomach to check the positioning of the baby. I have a whole video on that if you want. I'll link it below. During a vaginal exam, and then an ultrasound is going to be the most accurate way to tell us. Remember, breech isn't necessarily like a bad thing. It doesn't mean there's something wrong with you or something wrong with your baby. It's actually very common in early pregnancy. So when baby is little, sometimes they breech, and as they get older in weeks, they flip around. That's what happens for most people, and it's not a big deal. What we're talking about here is when they stay that way. They don't do that flipping. Now, is it bad? Does it mean your pregnancy is dangerous or unhealthy? No, okay? So it might be a little bit different. So the kicks, when you feel the little baby kicks, they'll be felt a little bit lower in the abdomen. For the practitioner, when we're listening to baby's heart rate, that will be at or above the umbilicus. So that's a little different, but overall the pregnancy itself is going to be very normal. And what are the causes of breech presentation? Well, when you have more than one baby in there, twins, triplets, etc., sometimes it's hard for them to figure out how to move around. So you might have a breech one. When you have too much or not enough amniotic fluid, so that's polyhydramnios, too much, and oligohydramnios, not enough amniotic fluid. If mom has a condition like fibroids, which are kind of getting in the way. If the baby is early, because like we said, it's very common in early pregnancy. If mom has a condition called placenta previa, so in placenta previa, the placenta is not implanting where it's supposed to, so that might cause the baby to not present the way it's supposed to. And I also have a whole other video on placenta previa that I'll link below. If mom has an abnormally shaped uterus, this could be another reason that the baby is breech. There are 4 different types of breech. So frank breech looks like this. So that's when baby's legs are straight up. Okay, so we say toes to the nose, frank breech. The buttocks is down and the legs are straight up with the feet near the head. Complete breech looks like this. So that's when baby's legs are crossed, like this. They're kind of sitting with their legs crisscrossed. The buttocks is down and the hips and knees are flexed. So that kind of crisscross applesauce sort of position. Footling is when one or both of the legs is down. So it could look like this, it could look like this, but their bottom is down, except the foot is what's actually the presenting part. So as the nurse or the doctor, who's ever doing the vaginal exam, sometimes you'll go to do the vaginal exam on these patients and you'll see a little foot sticking out and you're like, oh, okay, I guess we're a footling breech here. So that's when one or both of the feet is down. And then finally transverse. So in this position, the baby isn't vertical like with the other 3, it's like this. Okay, so baby is horizontal in the transverse position. In the beginning of this video, I mentioned that most babies will be breech at some point in early pregnancy, and that is normal. So when are we officially breech is when we are still buttocks down, buttocks being the presenting part, after 36 weeks. That's when we are officially breech, and it doesn't matter frank, complete, footling, it doesn't matter what kind. So what are our options for delivery? We have a couple of options. So the most popular is a C-section, and there's a reason for that. This is kind of like a doctor preference. Some doctors do not feel safe or comfortable to deliver a breech baby vaginally. So there are some risk factors associated with that, which we'll talk about here in a sec. But again, a C-section, that's a major surgery, and there are risk factors associated with that as well. So that's something that the patient and the doctor kind of need to discuss amongst themselves what they think is best. So one option, you can have a C-section. Your second option, you can choose to deliver breech vaginally. That does complicate your labor a little bit. It makes it harder for the baby to go through those cardinal movements. But the big risk factors here, injuries to baby's arms and legs, things like dislocations and broken bones can happen, and problems with the cord. This is really our biggest concern, and this is why so many doctors actually prefer to do the C-section, because what could happen is something called a cord prolapse, where the cord could come down first, and then the weight of the baby would press on the cord, and the baby is essentially cutting off their own oxygen supply, which could cause permanent damage, disability, and even death. So it is scary, rare though. Very rare, I want to make that clear, but it is a scary complication that sometimes physicians go, you know what, it's not worth the risk, I'd rather do the C-section. So those are options: C-section, deliver breech vaginally. And then our third option here is you want to deliver vaginally, but you don't want to deliver breech. So we can try to turn the baby so that it's head down. And that is called external cephalic version. So cephalic just means head down. So we're going to try to move the baby so that it is head down. And that might seem like, oh, well, why don't we just do that to everybody? Simple solution. It's not appropriate for everybody. So who can't get an external cephalic version? If you're actively bleeding, it's not safe. If you have a placenta previa, so your placenta has implanted near or above your cervical os, it's not safe for you to deliver vaginally in the first place, so we're not going to try to turn your baby. If you have multiples, so twins, triplets, etc., you have more than one baby in there, it's difficult to move one and not move the other. So you would not be a good candidate if you had twins. If they've done a stress test on the baby, so some monitoring for baby's heart rate, and it wasn't good, so baby didn't look good on the monitor, it might not be safe to attempt this. If mom has a low amount of amniotic fluid, that word from before, oligohydramnios, so not enough fluid. Or if her water has broken, so premature rupture of membranes, kind of goes along with bleeding, not safe to try to turn the baby if that's happened. Now, when it comes to these, there's a couple of conditions. One, not every doctor is wanting to do these. Just like some doctors, they won't try to vaginally deliver, they'll go straight to the C-section. Some doctors, they don't attempt to do a version. That's just not something they're comfortable doing. That being said, the ones who do it, it's around 60% success rate. So that's a good thing, right? It's better than half. But still, that doesn't mean it's going to work. But you have that option if you are not one of these categories of moms here. So just something to think about. You have options, something to discuss with your physician, what you're comfortable with and what they're comfortable with. And the last thing I wanted to make sure I mentioned is babies who are breech, regardless of how they're born, regardless if it was a C-section, if they got a version and turned and delivered, head first, or if they delivered vaginally breech. It doesn't matter. They've been breech this whole time in utero. They are at higher risk for something called developmental dysplasia of the hip. Now, does that mean that every single breech baby is going to have this? No, actually the majority will not. They are just at a higher risk than a cephalic or head down presentation baby. That's all. So it's something that after delivery that the nurse needs to be monitoring for. So very normal after delivery for a breech baby to have hyperextended legs and for them to be in that breech position for a little while because that's a position of comfort for them. That's the position they've been in for a long time. So it will take a while for them to, put their legs down, and that's okay. And because of that, it might look like they have a dysplasia of the hip when they don't actually. So this is just something that we need to keep an eye on for after delivery. And that was my video about breech presentation. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.